Thank you and a very warm welcome. So we'd like to start the webinar on postgraduate assessment updates. I'd like to introduce to you all Dr. Naveed Yousuf, who is the Chair and Associate Professor of Practice at the Department for Educational Development at Faculty of Health Sciences, Aachen University. He's also an honorary advisor on psychometrics for the Royal College of General Practitioners International South Asia, and is a member of the International Association for Educational Assessment. He also serves as national consultant on education for the Asian Development Bank. At the national level, he is also the member of the Board of Studies for PhD in Medical Education at Janassan Medical University and member of the Punjab Examination Commission. Dr. Yousuf is a PhD in medical education with a specialization in standard setting and psychometric analysis from Italy, and he also holds an MBA in hospital and health management from Institute of Business Management, Pakistan. He has over 15 years of experience of teaching as a faculty in various areas, and his areas, are ranging from psychometrics, of course, as his main specialty, to faculty development, educational research, academic leadership, and curriculum development as well. And he has also led and co-led some very important grants which are funded by UNICEF, European Union, and Asian Development Bank, as well as Aachen Foundation. He's also the recipient of University Innovation Impact Award of Distinction in 2022, which was last year. This was awarded in the global convocation held at Aachen University. He is also recipient of Faculty Development Award in 2013 and an Outstanding Teacher Award in 2012 at Aachen University. So a very warm welcome to you, Dr. Yousuf. So with this, I hand over to you. We will take the question and answers at the end of the presentation. In the meantime, if you have any questions for Dr. Yousuf, please, you can write in the chat box, or after the presentation, you can raise your hand and we'll be taking your questions accordingly. Thank you. Over to you, Dr. Yousuf.
Thank you so much, Dr. Tabassum, for this very elaborate, humbling introduction. It need not to be that long. And I would really like to thank SIVU and Professor Shabi for inviting me and letting me share my thoughts on postgraduate assessments during this session today. And thank you all for taking time out for this session. Let me share my screen, and please let me know if my screen is visible now, Tabassum.
Yes, it is.
Right. So when I was given this topic, I was wondering as to what I should share about postgraduate assessments. And what I thought then is, we all talk about programmatic assessment. However, it is not uniformly understood, and many of us have different understanding as to what programmatic assessment or a program of assessment is, and what we really need to ensure that what we implement as an assessment program really aligns with what is explained by the experts to ensure competency-based assessments for our postgraduate programs, and of course to ensure that our postgraduate learners achieve all the desired outcomes and competencies. So let us begin. So as I said, that the term programmatic assessment, it's still novel for many clinical educators. And there is a major disconnect between what is proposed as programmatic assessment by experts and what we think it is as frontline clinical educators to put it into practice and make sure it is correctly implemented. It is very essential to ensure that each one of us shares a very unified understanding of the innovative principles and practices which forms the basis of programmatic assessment. So the aim of this presentation is to define what is programmatic assessment and also what it is not, and to present some very macro level basic guidelines to help us design programmatic assessments for competency-based medical education for our programs. So the outline, the major outline after the introduction will follow what is the purpose of a program of assessment. We should be able to identify what needs to be assessed. We should be able to choose fit for purpose tools, establish the stakes of assessments, and process for interpreting assessment data. So these are the 5 steps that I will be talking on about in detail after elaborating on what an assessment program is. So the key features of the programmatic assessment include an integrated assessment program. And when we talk of integration, it means it has to be integrated with the curriculum. It has to be integrated with the instructional program as well. So the assessment program and the teaching and learning program or the instructional program for programmatic assessment has to be very tightly intertwined. And hence now you can imagine or think of a very traditional assessment where your assessment program is isolated, is periodic, is independent of what is being taught and learned. It happens at the end of the semester, it happens at the end of the clerkship, it may happen at the end of the year, or it may happen at the end of 4 or 5 years at times where postgraduate residency or training ends. However, for programmatic assessment, it has to happen day in and day out. The stakes may differ. So we will talk about the stakes later. Don't get overwhelmed by so frequent and so many assessments. However, it has to be hand in hand with the instruction which is happening. It has to be learner-centered. So the focus again now shifts from very traditional assessments, which is teacher-centered. The teacher decides what is to be assessed. The teacher does all the assessment, and the teacher or the faculty members make all the decisions. Here, the postgraduate learner becomes an equal partner. They know what will be assessed. They sometimes, to an extent, also decide what is to be assessed and when it should be assessed. And they are the equal partners in interpreting the data, in analyzing, reflecting, and assessing on their own performance, and then making decisions as to how they should improve upon any gaps. It focuses on outcomes and competencies. We will talk about these. And it is a mix of assessment for learning and assessment of learning. It is a mixture which incorporates multiple tools which are completed or assessed by multiple assessors to assess each of the competencies. And it should determine a trajectory of development for the learners. So when you develop your instructional plan, you keep in mind the development of the learners. What will your residents or postgraduate learners should learn in the first year of training or in the second year of training versus in the last and second last year of training? Similarly, the assessment program should be based on very similar rationale as to what they should be achieving in the first year and second year based on the instructions, based on the expectations versus the fourth year and final year, and how are we continuously ensuring that they achieve so, that they've achieved the expectations laid down by the stakeholders, by the program developers, curricular developers, and faculty members. So When I looked at the literature as to how programmatic assessment is defined, the first definition is by Vlutin himself, who proposed the idea that it is the arrangement, a very careful arrangement of assessment methods planned to optimize fitness for purpose. It is the intentional combination of different assessment methods and tools which meet the essential criteria, and we know this is validity, reliability, and impact on learning. It is an assessment approach which is very, very close to instructional design and goes hands in hand, as we discussed. Multiple assessment tools are used to maximize assessment for learning. Now, this is very, very important, and ensure that combination of evidences from these multiple tools are collected, which results in a defensible assessment of learner competence for all outcomes. So the important point here to note is that there should be multiple low-stakes assessments which would lead to high-stake decision-making, or which should lead to high-stakes assessments. It is decision-making based on multiple data points using multiple tools, as we discussed. Decision-making in which the number of data points is proportionally related to the stakes of a decision. So now, for example, for the clinical knowledge and application of knowledge, it is very, very important. So how frequently are you assessing students' application of knowledge? How frequently are you assessing students' competence and ability for clinical skills and procedures, for history taking and communication skills? And the data should encourage the learner to improve their own learning, to reflect on their performance. And they should be then equal partners on as to how they are going to move forward and improve upon any gaps. The progression decisions or high-stake decisions are dependent upon the compiled evidence from multiple observations, multiple assessments from multiple observers. So now think of your very traditional assessments, whom we just combine and interpret as this is a program of assessment. So programmatic assessment is not a single examination, even if that assessment tends or aims to cover all outcomes. It is not a single tool for all data collection. It is not collection of only positive and encouraging feedback. So the candidates, the learners need to know as to when very clearly, very transparently, as to what are the gaps, what they are able to do at any given point in their training, and what they need to learn further. It is not individual assessment methods in isolation for separate courses, clinical rotations, and competencies combined together. So when we very traditionally look at, and in my experience, different so-called programmatic assessments for different programs, what we see is that they have certain tools to assess different competencies, such as health advocacy, and other tools which are periodically being implemented to assess the clinical skills or knowledge. And then all data is this combined to make decisions, high-stake decisions. This is not programmatic assessment. So before we sit on the table with our stakeholders, with curricular developers, faculty members, and other decision makers to design or develop an assessment program, we should keep this principle in mind. The principle is commonly known as CARVE principle, and it is a combination of 5 different principles of good assessment. It starts with C, which is cost effectiveness. And cost effectiveness of our assessment program is not only looked at the financial costs, it is also looked at the opportunistic cost and human resource cost. How much assessment and what kind of assessment? Do we have the resources? Do we have human resources which can properly and appropriately and correctly implement those assessment methods? Do we have the capacity to develop the faculty and administrative staff to implement such assessments appropriately? And then there is acceptability, which is again, I would say, directly related to the readiness of the faculty members and of the learners and of the specialty, acceptability to the specialty, to the discipline itself and the relevance. So do the learners, in addition to the faculty, are also aware of these assessment methods? Are the expectations very clear? Are the use of these assessment methods very clear to your learners? All comes under acceptability and contributes to the acceptability. Then again, the very commonly discussed and very essential elements, reliability and validity. Reliability, we know, is the consistency in the decisions of assessments and is directly related to the number of observations and to the number of observers. And validity is, of course, are we measuring what we intended to measure? What are the different kinds of tools we are using for the different outcomes and competencies we have identified for our programs? And lastly, what is the educational impact of the assessments? So educational impact at an individual level and educational impact at the systems level. When we talk of the individual level, we think of the learner. So how each of the assessments carefully placed at different times in the program is impacting the learner for more effective learning, is motivating the learner, and is giving feedback to the learner about his or her abilities and competencies. Are we only assessing knowledge and skills? What about other outcomes? How will it motivate the learner to also focus on all other outcomes? How will it provide feedback? How will the program provide realistic feedback to individual learners as to how much they have developed each of the competencies if those are not being assessed? And at the systems level as well. So all these assessments must inform the faculty members and curricular implementers as well, and allow them to make changes and revisions in the instructional program, in the experiences of the learners, or in the curriculum itself to improve or enhance the quality of learning for each of the outcomes. So how is this data from different assessments are used at the systems level by the programs themselves is equally important. So number one. The first step is to articulate the purpose of assessments. Why do we want assessments? Do we want assessments for assessment of learning? Which is, at the end, we want to make some high-stake decisions about progression, about certification, about licensure for practice. Is it about assessment for learning, which are low-stakes assessments which provide information to the learners and to the faculty members for the level of their competence? And what the learner needs to do more to improve their performance, and enabling the teachers to make changes or revisions or adjust the learning experiences to enable further learning. Or is it for assessment as learning? So assessment as learning is assessment during which the learners gets opportunities to reflect on their own performance and learn. A good program of assessment would carefully include a mix of all these three kinds of assessments: assessment for learning, assessment of learning, and assessment as learning. And as prescribed in the literature, most of the assessments in a good postgraduate program of assessment has to be assessment for learning or assessment as learning, periodically culminating in high-stake decisions based on all these data points coming from assessment for learning, or having periodic assessments of learning as well. So what needs to be assessed? Of course, the programmatic outcomes. We all have certain outcomes, attributes, competencies laid down for our postgraduate programs. And then now we know that all these outcomes or competencies needs to be broken up as skills, behaviors, and knowledge to be demonstrated by the learners. Some call them enabling competencies, others call them sub-competencies. Then these are again broken down into interestable professional activities. So it depends as to what kind of classification do you use and how do you want to break up. However, to maximize learning and to make sure that your assessments and your competencies enable the learners to learn the right things, it has to be broken down into simpler terms in micro steps as to what needs to be learned as the learner progresses from the first year and the first month to the last year and the last day. Also, when you break up these mega competencies and outcomes into enabling competencies or interestable professional activities, please bear in mind that you will also have to think of the different contexts in which these competencies needs to be demonstrated. Because the content and the kind of skills to be demonstrated will change depending upon the context, such as patient interaction in an outpatient, or in the community setting. Or when you are teaching or the learners are learning to communicate with different patients of different age groups, such as pediatric versus adults versus geriatrics. Or how would the communication and counseling skills change or would differ when you are dealing with your patients coming from different socioeconomic backgrounds or from different value systems and so on. And hence, the assessment tools and processes, the mixture of assessment tools and processes has to allow for differences in context to ensure that the learners are adequately assessed for the necessary skills, behaviors, and knowledge across these different contexts in which you expect your learners to perform eventually, to practice. And also, what we have seen and what different researches and programmatic evaluations have informed us, that there tends to be a very heavy focus on knowledge and skills, and all other competencies are more or less ignored. A few of them are very largely ignored. Though in a good assessment program, all competencies need not to be equally focused. You may focus a few more and more frequently, such as application of knowledge and clinical skills and procedures and communication skills, and you may focus on a few, maybe less. However, one has to ensure during planning and implementation that there is a very appropriate balance and all outcomes and competencies are getting their due share of importance in your learning, in your program of learning. Let's move on to step number 3. Once you have identified what needs to be assessed, now you need to choose the different assessment tools and methods. And as I said, in a good programmatic assessment, you need to carefully choose different methods and tools for each of the competencies, regardless of the evidence available in the literature. What is found that no one tool is good enough for any of the competencies. So one has to ensure that one is using carefully selected combination of different tools for different competencies implemented in different contexts for different stakes assessed by different assessors. And for low stakes assessments, the assessors can also include the learners themselves, the peers, and the patients. It need not to be the faculty every time. And hence, cost effectiveness is equally important. So the choice of the tool and the frequency of the tool must also consider the effectiveness, which does not only include, as I said, the finances, it should also include the time taken within these programs for these assessments and burden on the faculty and assessors. And also to make sure that the multiple assessment tools in general cover all the competencies and outcomes. Consider the stakes of assessment. A good programmatic assessment will require a very careful, delicate balance between low stakes and high stakes assessments. Low stakes assessments will largely function to optimize learning, to track your learners' development in each of the competencies, and they should get an opportunity to practice in a safe environment, an opportunity to learn from their mistakes and reflect on their performance gaps. Can all low stakes assessments be completely formative? Literature suggests it is not possible. It is not possible to have so many low stakes and so many high stakes assessments. So a few low stakes assessments must feed into high stake decision making. So in a good program of assessments, there has to be multiple assessments for learning. Most of them will be, in fact, low stakes. And many of these will be solely formative. A few of them will be used as multiple evidences for high stake decisions, for promotion, for progression, and eventually for certification and licensure. And that choice as to what kind of assessments will be used solely for formative and can also be used for high stake decisions and how needs to be very clearly communicated, of course, to the learners and to the faculty. And the last important step is how now is this assessment data used? So there has to be very clear outlines for data collection, for data interpretation, and then decision making. Here, the decision making for low stakes assessments would be what additional learning experiences does the learner require? What remediation? What kind of support? What kind of learning resources? For high stakes assessments, the decision making will be, of course, decisions for promotion, progression, and licensure. The literature also talks about role of committees. And this is how competency-based assessments And competency-based medical education and programmatic assessments differ from traditional assessments. So in traditional assessments, it is only the numbers coming out of assessments which makes the decision. Any learner getting a 70% should pass. Any learner getting a 90% will get honors or scholarships, or will be recognized for high performance. This is not the case for competency-based assessments and for assessment programs. There has to be qualitative judgments and feedback. So literature talks about roles of competency committees or residency committees or training committees coming together to discuss the performances, to discuss the data coming out of these assessments and interpret, and then making qualitative judgments as to what each of the learners have achieved, what are the gaps, and what decisions need to be made. All this information coming out need to be shared with your learners. And hence your learners become equal partners where they also get to know about their performances and make decisions. Transparency of such decision-making processes so that everybody is aware as to from where and what kind of assessments the data will be collected, how will this be interpreted, and what kind of assessments will be used for what kind of decision-making and who will make the decisions is very, very important. It will ensure compliance, trust, and equity. So, in summary, programmatic assessment is not one size fits all. Each one of us will have to think of our contexts, of our resources, of our programmatic requirements and learning outcomes. It is important for each one of us to understand what programmatic assessment is and what it is not. The principle CARVE, which was cost effectiveness, including your human resources, acceptability, reliability, validity, and educational impact, can help us as a compass to make movements and strides and the next steps in the right directions. And the 5-step process described in this presentation, as I elaborated, can help us implement a good programmatic assessment for our postgraduate programs. Thank you. Tabassum?
Thank you so much, Dr. Yousuf, for such an elaborative presentation. We now move on for the question and answer session. And to begin with, I have one question from Mona, and she talks about how can you measure the educational impact of a curriculum?
Okay, see, the question I want to just clarify, are you talking about educational impact of assessments or are you talking of educational impact of the curriculum? Because
yeah, I think it's related to educational impact in terms of assessment. Mona, could you please elaborate if you can unmute your mic if you want to further clarify the question?
Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to thank you very much for your very eloquent and informative presentation, Dr. Yousuf. I was referring to the thing that you mentioned, the educational impact. While doing the programmatic assessment, you are trying to measure the educational impact. So the educational impact, of course, is that of the curriculum, but how are you going to assess that? This is what I meant.
Right.
Thank you.
So a very good question. See, when we say assessment drives learning, number one, there is also critique of this stance, and one may say this is an external motivator. However, learning has to be internally motivated. There are multiple researches and evidence which suggests that this external motivator plays an equally important part to drive learning. And not only to drive learning, to drive intended, appropriate learning. So your assessments will determine as to what kind of learning your learners are doing. For example, when I give these examples, I talk about if your assessments of knowledge is only at the recall level, the learners will only focus on recall. They will not be bothered to interpret. I also give an example of an international licensure exam, which is USMLE. So at one point in time, if you remember, the United States medical licensure exam only consisted of written one best MCQs. And if you would have noticed, the learners who were aiming to go to United States to practice, they would spend most of their time in the libraries or practicing these written one best MCQs. As soon as they introduced the third clinical skills assessment, CSA step 3 or step 2 CSA, all the behavior of the learners changed. They started to going into the wards, they started to learn on the bedside. And this is what I mean when I say educational impact of assessments. So if you have no assessments for professionalism, if you have no assessments for communication skills, if you have no assessments for health advocacy, for social accountability, first, the learners will not focus on developing these competencies and outcomes, which are equally important. Second, as faculty members, we will not get any information as to how our learners are developing in these outcomes and competencies. And hence, we will not be able to help them achieve the level of ability and competency we may want them to at the time of graduation. So this is what I refer to when I say educational impact of the assessment. So you have to make sure that your assessments are very carefully planned to cover the wide range of outcomes and competencies laid down as the intended outcomes of your program and in different contexts. Those assessments are appropriately implemented, and the information coming out of those assessments are used by the faculty members and the learners to improve learning and development. If you are not assessing first, you will not get to know. You are blinded. If you are assessing, however, if you are not correctly assessing, and that will lead to wrong kind of learning for these outcomes. So for example, a very narrow approach, again, another example, for communication skills, for only one context or for one kind of patients, which are the usual kind of patients or the norm, not thinking of the minorities, not kind of people coming from different value systems or religions, will leave out that kind of learning from the students' experiences. However, when we will talk about the educational impact of the curriculum, this is a totally different game, and hence I wanted to understand where this question is coming from. I hope I've been able to respond to your question, Dr. Mona.
Yes, thank you very much, sir. Thank you.
So yeah, very elaborative response. Now we have questions coming in. So the next question is from Dr. Muhammad Asif Mughal, and he wants to know what is vendor Waller's notion of assessment utility.
Thank you, Asif, for this question. A very commonly referred, a very commonly used concept of assessment utility, very commonly available in the literature. There is a formula which also uses many of these concepts which we discussed today as to what is the cost and what are the different impacts and uses of the assessments with regards to the validity specifically, and of course the reliability. So all in all, when you look at your assessments through these multiple lenses, you get to know what is the utility of your assessment. So for example, a very costly assessment, which is not adding much to learning, may have very low utility. So I will request you to go back to the literature. There is a lot available there, and a lot of articles, because a lot of master's level theses in our programs also use this to evaluate their own assessments. However, the factors taken into consideration remain the same: cost effectiveness, acceptability, validity, reliability of different assessment methods to inform learning. How are they feeding into improvement in the learning? Tabassum?
Yes, thank you so much. There is one more question coming in from, I guess it's Dr. Mubashir who has put in this question. And the question is related to what are the learning outcomes of a postgraduate program? Dr. Mubashir, would you like to elaborate on the question?
Yeah, I would like to thank you so much, Dr. Naveed Yousuf, for such a wonderful and elaborate presentation. Yeah, what possible outcomes, learning outcomes can we get from it?
Right. The most commonly talked about learning outcomes and competencies is, of course, the right kind of knowledge. Are the students able, have they acquired the knowledge required for the discipline, for the specialty, for this program to practice independently, and have they acquired the skills? So these are the two most important things which are talked about since decades and since centuries. However, now we know that there are other learning outcomes which contribute to the effectiveness of the practice, clinical practice, and which contributes to the effectiveness of the clinician or the practitioner, and which includes communication skills. And there have been studies which prove that many of the gaps and errors which were done by the clinicians were not mainly because they didn't know the knowledge and they didn't have the skills, were because of communication gaps. Either they were not able to communicate to the patients or to their team as to what needs to be done, or health advocacy, or social accountability, or professionalism, or scholarship itself, or teamwork, or interpersonal skills. And now we are also largely talking about digital literacy. With this all artificial intelligence coming in, will our learners be able to cope with all this information and practice in the new world and in the new norm? We cannot even imagine how the practice will change after this artificial intelligence and chatbots and ChatGPTs will become common. So we have to make sure that our learners are equipped at least with the basic skills so they can function appropriately in the new norm. And hence, when we talk of learning outcomes, you can look at the learning outcomes of different programs in different parts of the world, from different accreditation, international agencies. However, if you try and align them, most of them talk about the same things I have just elaborated on. Tabassum?
Yeah, thank you. I think this connects to the next question, which is also talking about technology and digital transformation in assessment. So the question is from Dr. Badr, Al-Sheikh Badr, who is asking about how do you see the role of technology and digital transformation in assessment in the context of residency?
Thank you very much. So as technology and digital transformation have a huge role to play in assessment with regards to feasibility, which is cost effectiveness, with regards to reliability, and with regards to validity. Let me give you different examples. First, use of simulation to learn of or assessment of skills in specialties which are largely dependent on psychomotor skills, procedures. And when you have these simulations, either you use it for low stakes or high stakes decision making. They are such sophisticated gadgets, softwares, and tools which will allow your learners to practice, which is very close to the real life practice, and will give them automated, accurate feedback on their performance, including how were their hand movements, what steps did they do wrong, what steps did they miss, and what needs to be improved. Second, when we talk of competency-based assessments and when we talk of programmatic assessments, there was a lot of concern on paper-based assessments and feasibility of assessments. With technology coming in and different softwares, which now allows the faculty members to use their cell phones, tablets to rate the learners, to rate their performances, which is then recorded, and very good interpretations or feedbacks or graphs are then available immediately for learners and for the faculty members. So this is how assessment is being improved. Second, it is also changing the practice. So if you may remember, decades earlier, the assessments or education required the students to learn facts, factual information, because information was not easily available to practitioners. Now, since information is available to practitioners on their palms, now we say we need to assess the skills of our learners to find out the information, to filter out accurate versus inaccurate information, to go to appropriate sources and use that information efficiently. And now with artificial intelligence coming in, the role of the physicians, the role of the doctors and surgeons probably will move much beyond, and basic level probably, which I hypothesize, basic level of algorithmic decision making may be left or would be left to artificial intelligence. So there is a very big role of technology, and with time, I think it will proportionately increase. Tabassum?
Yeah, of course, there's a role of technology, and as we move forward with the use of technology, there also comes a role of ethics. And Dr. Shabi has, a question which is related to the ethics and the use of artificial intelligence and its judicious use, basically ethical judicious use, particularly with ChatGPT now coming in. So what is your take on this? How do you think the use of AI in medical education could be used ethically, particularly the ChatGPT?
At the moment, we did a few studies, and since my team belongs to the discipline of medical education, we did a few experiments using ChatGPT for medical education. I will give you a couple of examples. A few of them worked, a few of them did not work. We requested ChatGPT to respond to certain one best MCQs. It did a fairly good job. We requested then ChatGPT to explain why is this the best option and not the others. It did a fairly good job. We requested ChatGPT to change minimal information in the question such that the best option is changed, that this one of the distractor becomes the best option. It did, however, it made certain errors. We requested ChatGPT to draft or develop for us an essay or an article on a topic with, for example, 12 references. The article was very nicely developed, one of the best. However, all the references were made up. None of the references were the actual references. The author names were correct. Those are the experts in the field who publish on those topics. The journals were correct. Those journals do exist. However, the combination of the author names, the title of the articles, the issue, and the journal was not found when we searched. So it is producing errors, and it is, I think, some time at least, if not long time, where we have to train ChatGPT to give us accurate information. However, as I said, and let me give you one more example very quickly. When I started teaching, and this is around 15 years ago, and we used to do problem-based learning for basic sciences with our learners. And what we used to observe that most learners, when they go out, find out information and come back in the problem-based learning sessions to provide possible explanations of why something is happening, many of them used to bring in misinformation, false information, incorrect information, very convincing, with a lot of reasoning, however inaccurate. And there was one source. The common source was Wikipedia. Wikipedia improved, and now Wikipedia is the source of most authentic information on the internet. And likewise, I expect ChatGPT to improve. And when ChatGPT improves, the role of the physicians will move much beyond artificial intelligence. So effective clinical practice, efficient clinical practice the first level will be, as I think and as I hypothesize in future, will be the first level of decision will be made by artificial intelligence. And I expect it will be more based on best evidence. It will be based on the factors related to your patient, individual factors related to your patient. It will be based on cost effectiveness. It will be based on the best evidence in the literature, and it will be very quick. However, the second layer, the second tier, will be the physician himself or herself to accept or not to accept what has been decided by artificial intelligence. This is what I think the clinical practice would look like in the future. Sorry for a very long answer. Tabassum.
Yeah, I think that was a very elaborative response, and we as medical educators and clinicians would have to be very careful in using ChatGPT in terms of student and resident assessments. So we'll take last two questions, and the next question is again related to postgraduate assessments, and it talks about, do you think that there are some modalities of assessment which are missing in the postgraduate training, particularly in Pakistan?
Yes, of course. Think of the different outcomes and competencies. Where are we assessing social accountability or advocacy? And now think of even more important outcomes. Are we really assessing professionalism? Are we assessing it appropriately? And now come to clinical skills. In 5 years of training, how frequently do we observe a learner's skills, performing skills? Of course, the response will vary from program to program. However, it is not sufficient. It is not enough. So yes, there are a lot of gaps, and it needs to be improved. Tabassum?
Yeah, I can see that Dr. Mona is still struggling how she can apply the principles that you have elaborated in your talk in the postgraduate assessment. So yes, but still she have a question, and probably that would answer her question and decrease her anxiety. The question is that, is Pakistan offering remote assessment to postgraduate international institutions during which actually commenced during COVID, and have this been continued?
Sorry, Dr. Tabassum, just to interrupt, this might be a different Mona.
Yeah. Yes, Mona, please.
This is Mona. No, that's all right. Just clarifying, so I'm Mona Rizvi. I think that was Mona also. So my question is regarding...
The first Mona was talking to you from Alexandria, Egypt. Definitely, you are different, Dr. Mona. Go ahead.
Yeah, that's what I was also talking about Pakistan.
Right. Yeah. So my question was regarding remote assessment. So just wondering about the most appropriate ways of applying these principles that have been elaborated in the talk today. on remote assessments? And also, I just wanted to know whether Pakistan is offering remote assessments anywhere. And like, for example, in COVID, I know in certain countries, assessments moved from face-to-face to remote, quite video-based as well. And they have continued actually since. So just, it would be nice to know what's happening in Pakistan and how these principles can be applied to remote assessment.
Okay, so first let me talk about assessments and remote assessments, or assessments at the postgraduate level. So in Pakistan, since the postgraduate learners were part of the clinical teams, so they didn't went remote. They were there in the wards, they were with the clinicians and with the doctors. So there was no need for remote assessments at the postgraduate level in Pakistan, at least. And that I believe happened in most parts of the world. They are considered as part of the practicing team, and they remained in the wards, and everything continued as pre-COVID. For undergraduate, yes, a lot of assessments went remote. And when now we are back on site, at least for the Aga Khan University, I can talk, all assessments are now back as they were pre-COVID, because what we believed when COVID came, the assessments which went remote were a quick fix and a compromise. So we were not very much satisfied. However, when we talk of teaching and learning in contrast, the students were happy with a lot of additional support which was given to them online. And now we are continuing this additional support to much extent coming back to on-site teaching and learning. However, for assessments at the postgraduate level, nothing changed, because our postgraduate learners were in the wards. They were very much, and they are part of the clinical teams. They were providing service to the patients. For undergraduates, most assessments or all assessments and teaching and learning went remote. When we came back, a significant portion of online teaching and learning is retained, however, as an additional supplement to complement and support the on-site teaching and learning. However, most of the assessments have reverted back to on-site assessments. Mona, Tabassum?
Yeah, thanks, appreciate that, thank you.
I think that answers your question, Dr. Mona.
Yes, it does.
Right. So we are, I think, done with the question and answers. And now I would like to thank Dr. Naveed Yousuf for providing his time from his busy schedule on such an important topic. And this has been a very enlightening talk for all of us. With this, I also would like to take this opportunity to introduce the conference that I talked about. And this is the conference that's coming up in May from 18 to 20th. And it's the first hybrid international conference being held at Aga Khan University. You're most welcome to join this conference virtually or in person as feasible to you. It highlights national and international talks by experts in health professions education. There are some very interactive and very enlightening courses that are going to be offered, both on site and online, that are also from national and international experts. And we are also going to gather our health professions educations graduates and program directors on board in this conference to have a meeting with them. And it's going to be by invitation. And of course, there's also highlight of our Master of Health Professions Education graduates celebrating the 10 years of MHPE at Aga Khan University. So Dr. Naveed, if you just would like to take a couple of minutes to elaborate, and then I'll invite Dr. Shabi Zedi to talk on the upcoming book on global medical education, the challenges that prevails during the normal and in challenging times. Yes, Dr. Naveed, couple of minutes for for you.
Thank you so much, Dr. Tabassum Zehra. First, I would again like to thank SIVU, Professor Shabi, and to you, Dr. Tabassum Zehra, for providing the opportunity to share my thoughts on assessment. And I would also like to thank the participants, not only for their time and careful listening. However, I think the Q&A session, which was much more engaging and was much more informative than the talk as well. So thank you so much for your questions and for your engagement. Regarding the conference, we are at AKU, Department for Educational Development. We are trying our best to come up with a very good program offered by international and national experts. We have kept 2 days, May 18th and 19th, for pre-conference workshops and courses. And to ensure maximum engagement, these are either online or on-site. So when you go for registration, you will find options for online workshops and courses, and options other are on-site. So if you are planning to come to Karachi, or if you are in Karachi and plan to attend it on-site, choose from the on-site courses and workshops. If you plan to attend online, choose from online courses and workshops. The courses and workshops are by experts in the field. They are also very, very carefully selected. The 2-day pre-conference courses are the major highlight of the conference, where some very rigorous packed courses are offered by real experts in the field. They will be hands-on, experiential, whether online or on-site courses, and workshops are also very, very carefully chosen by different experts. The other highlight of this conference is that it talks about some very unique and emerging concepts in health professions education. So the keynotes, the 4 keynotes by international and national experts, will be on impact, quality, relevance, and access in health professions education. What do they mean? And if we want to ensure impact or relevance or access for health professions education for our programs, for our institutions, what is the way we need to charter on? Where should we go? What is our aim? What is the vision? And hence it makes this conference very unique in this sense as well. So thank you, Tabassum, for an opportunity to elaborate on this conference. Over to you.
Thank you. I would like to thank SIVU for providing us this platform to showcase the upcoming conference, and also the participants to joining and, asking some very important and very pertinent questions related to the talk that Dr. Naveed Yousuf have given to us. And in the end, I would request now Dr. Shabi Zaidi to please talk on the upcoming book on global medical education. Dr. Shabi Zaidi.
Well, thank you. Thank you, Tabassum. I don't know if you can see me or not, but it doesn't matter. Well, thank you, Naveed. As always, the standard is very high, and every time I listen to you, I learn. I want to go back to school. And particularly if you're the teacher, I'll sit at the front, I promise. Now, that means that you have to come back. We're starting the certification course with the University of Kufa, and your lecture, and I've sent you a program in detail, but I'll give you the dates. Please mark your calendar. It's 2nd of June that you have to give a talk to our international students. The topic is setting realistic goals and expectations for students in clinical teaching, clinical settings. So you can check on WhatsApp and also the CV, and also we have sent you an invitation formally. The Dean of Kufa University will also write to you personally. So that's one. Sorry, go ahead. You have to say something, Naveed?
Thank you. Thank you so much for the invitation, and it will be a pleasure, Professor Shabi, to contribute.
Thank you, Naveed. So moving on about the book, I've been very encouraged. I mean, Tabassum, Sholeh, and Shahid helped me in compiling that book, which is the Global Medical Education in Normal and Challenging Times. It's taken almost 18 months to compile and submitted to Springer. Springer have now sent the link, so they'll take maybe 6 more months before it comes out in the print. Today only I received the link saying that it's going to be not only a print, but also an ebook for reading on Kindle and mobile and what have you. So I think that's wonderful. So I'm grateful to all the authors and scholars who have written and contributed. That has given me the encouragement to invite you all again to a mega project we just started with the University of Kufa and Najaf and Cebu, a compendium of knowledge in medical ethics. It is called Encyclopedia of Islamic Medical Ethics. Please come forward. I need at least 2 volumes. The first volume will publish by the end of this year, hopefully. I have about 40 or 45 chapters already with me, which I had gathered for a different purpose, but I'm going to use it for encyclopedia. I'd like everybody to contribute. Please chip in, send me your topics, and we have the illustrious Dr. Fatma Jawad. She's the editor. You look at it, and I have a panel of experts, reviewers from different countries who will review the articles, chapters, in fact. Now, remember, the write-up or writing pattern of encyclopedia is totally different to the review article, the original article, the case report that you've been writing. For that, you should refer to Encyclopedia Britannica and write in that format. And we'll do the referencing, either the APA format or whatever. And all that is available on our website. Come forward to it. The third and final thing is the Iran conference is coming up in May, ICHEP, which is also international. CB is participating in it actively. Please come forward, send your abstracts and participate actively in it. Thank you so much. And thank you again, Naveed, and thank you, Tabassum. It's the end of this session. If anybody has to comment before we close.
Yeah, and I would like to thank Dr. Mubashir as well for all the support that he has been providing from the platform SIVU and being in Malaysia. So thank you so much, Dr. Mubashir, for being with us. With this, we now conclude this session. And if you have any further question, you can write to Dr. Naveed Yousuf at his email address, naveed.yousuf@aku.edu. And he will be happy to answer your questions. Thank you so much. Thank you, everyone.